Hello everyone. I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be speaking about management of hiccups in cancer patients. Many a times I come across patients who are undergoing any sort of cancer treatment that they are experiencing hiccups. So now, how the question is, how do actually hiccups will occur? Let us try and find out what exactly causes hiccups and what are some of the tips in how we can manage the hiccups as well. So first of all, hiccups can occur when you get a spasm in your lungs, in your diaphragm between your normal breaths. Okay, we obviously can't control the spasms, and but the hiccups can surely go away on their own. But when hiccups are a symptom of the cancer, which is a side effect of the cancer treatment, they can also persist for longer. So what happens is this makes the patient tired and difficult to cope up with. Okay, now what are the causes of hiccups? There is no actual cause of hiccups. The etiology of hiccups is unknown. However, there could be certain triggers which can cause a hiccup. So what are these triggers? These triggers will include eating or drinking too quickly, incorporating fizzy drinks or aerated drinks into your diet. Sometimes if you are going to overeat, then that also could cause hiccups. Next, even a heartburn can cause a hiccup as well, or even certain medications or stress can also be a cause of hiccups. Now the thing is, if you have cancer, then why are hiccups caused? Okay, so sometimes if you are going to have bloating or there is going to be extended abdomen, then it can also cause bloating. If you are going to be having an infection that is affecting your chest or food pipe, which we generally call it as a esophagus, can also trigger a hiccup in cancer patients. If you are under certain chemotherapy drugs, okay, and if the tumor is pressing the diaphragm, then also it can cause. So hiccups can naturally go away on their own, but they can surely be troublesome and last for more than a few days as well. So if you are going to be experiencing hiccups persistently which is not going away, it is always important to consult your doctor, who is going to let you know what is the kind of treatment which can be done so that it will help you to cope up with this. Okay, now let us go into and see what are some of the ways in which you can manage hiccups. Okay, so first of all, it is important that you are going to gargle or drink ice water. Okay, you can eat or chew on a small slice of bread slowly. All right, next, it is good to take a deep breath. Okay, and you can also suck on a lemon, and you can also try drinking peppermint water as well. Okay, now breathe in and out of a paper bag, but however, ensure not to use a plastics as well. So now what can happen if there is persistent hiccups which are not going away at all, because they can last for more or a couple of days as well, which can also be very disturbing. So yes, this of course requires a medical treatment and you need to visit your doctor as well. Your doctor needs to find out the reason as to why have you been getting persistent hiccups, so they need to treat the cause when they find out. Okay, so generally what happens is the doctor will also be giving you certain medications which will also help you to relax the muscles, or also they will help in reducing the hiccups. Hiccups can also be caused if there is going to be gaseous discomfort or acidity as well. They will also be prescribing you an antacid or a proton pump inhibitor also. So now let us try and understand what other foods have to be avoided in the diet if you want to reduce hiccups. So as I mentioned earlier, sometimes hiccups can also occur if you are going to eat more of gaseous foods. So what are those gaseous foods? Generally, cruciferous vegetables such as your cabbage, cauliflower or broccoli do contain a carbohydrate called raffinose, which is going to cause gaseousness or bloating. Certain pulses or legumes which are heavy, such as your rajma, chola, chana, are also going to cause gaseous discomfort. So, how can we help in minimizing these gastric discomfort or symptoms of hiccups? First of all, you need to ensure to have small frequent meals in your diet. Okay, and when after eating a meal, it is advisable to leave a gap of 3 to 4 hours before you are going to go to bed, because during that time it is going to help in the enhanced digestion of the food as well. Okay, try to engage in regular physical activity rather than using whole pulses and or heavy pulses. Use moong dal, which is easily tolerable to the gut. Okay, acidity or gastric disturbances can also be caused because of having more of tea or coffee consumption also. So it is important to reduce the consumption of tea or coffee as well. All right, and then try to avoid cruciferous vegetables in your diet, as I mentioned to you earlier. So these are some of the tips which you can surely follow in your daily routine, which will help you in reducing the symptoms or the effects of hiccups. To conclude, management of hiccups is important. If they are mild in nature, then you can always include the remedies or the tips which I have shared with you in this video. However, if you have been facing persistent symptoms or persistent hiccups, then it is always advisable and recommended to meet your concerned doctor, who is going to be telling you as to what is the line of treatment or what drugs are to be given to you. But all of this is going to be based on what is the cause of the hiccups. Thank you so much for watching my video. We at ZenOnco.io are here by your side to navigate you through your journey. In case of doubts or in case of assistance, you can surely reach out to our cancer coaches on the below mentioned contact number.